in line with that, just as a reminder, the mayor's order that was issued all the way back in the spring does require for all of our placements, anyone who works in a residential placement, any kind of a residential placement, should be screened prior to starting their shift. And that screening should be documented. The screening needs to include a questionnaire regarding any current COVID symptoms, a temperature check, making sure that you are questioning the person about any contacts that they have had in the screening. Have they had any contacts recently with any person who has tested positive? If they've had direct contact exposure with a person who has tested positive, then they should be quarantining. Or if they are currently experiencing any symptoms. And, it's really important that each of the provider agencies keep up to date. The CDC website includes the symptoms you should be watching for, and those are updated as the information about COVID-19 is updated. So just keeping in mind that today, the symptoms that they're reporting that people should be watching for would be any fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, any new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. These symptoms can explain all kinds of different things. And so, it's very important that someone not be dismissive if they have these symptoms, because it could be coronavirus. And so people shouldn't be going to work if they are experiencing these symptoms. And they should be screened when they get to work to make sure that they don't have any of these symptoms or a temperature, or that they have traveled to any of the states that are on the list. There's a recent mayor's order that identifies exactly the steps people need to take if they travel out of state, or if they have had direct contact exposure with a person who has tested positive for coronavirus. That needs to be reported. So, and they should not come to work. The exception there would be if the exposure was there at work, then they should be monitoring their symptoms. And it is okay for them to continue working, because if you're working with someone who has coronavirus, if you had to quarantine after your exposure, then you'd have to have new staff every single day. So, but if a person has had that exposure, they need to be monitoring their symptoms closely and quarantining outside of work. So even though they can continue working, they should be quarantining otherwise. Like I say, we have seen recently some spikes in the area and in the country. It is essential that we continue to be vigilant about this, that we continue to make sure that we're monitoring and that we're taking all the necessary steps to prevent any future infections certainly by the staff or by the people that we support. So specifically for in-home and companion, is it mandated or required for our staff to take their temperature every time before beginning a shift, or is it a recommendation? FYI, we have the questionnaire with all of the COVID-19 symptoms and related questions, keeping in mind that temperature checks are not a proven way to detect COVID-19. So in answer to your question, no, because the mayor's order does just apply to, well, when you say companion, it depends on where they're providing them. So if they are coming to any of our residential placements, which would include supported living or reshab or ICE or intermediate care facility, then yes. if they're providing the services there. If they're doing in-home services, is that captured by this order? No. Is it best practice for you to do? Absolutely. It is absolutely true that checking for someone's temperature doesn't mean that if someone has a normal temperature, it doesn't mean they don't have COVID. But if they have an elevated temperature, it means they should not be working, regardless of whether it is COVID. So doing that kind of screening before people go to work, and this is the same kind of thing as the district government has been doing its reopening plan. We have this questionnaire that we have to fill out before we come into the office, because we're not alone here in the office, and you can be exposed to other people. And so, in terms of your personnel practices, it would be good personnel practice to make sure that you're screening staff before they have contact with someone. The issue that the person raises about the temperature, not having a temperature doesn't mean you don't have COVID, is a very good point, which is why we need to be vigilant about using proper PPE, because any one of us could potentially be an asymptomatic or pre-symptomatic person with COVID and could potentially then be infectious. So that's the reason that we need to check for these symptoms and continue to use proper PPE. So, a combination of all of those things are the best way for us. As I had shown the chart last week, our numbers have come way down. We would really like to see them stay way down. As I said, up until this week, we had no new COVID reports of COVID for the people we support. And then there were 2 new reports this week. I hope that we can continue to be vigilant and careful and continue to see people stay healthy. We do have 2 people who will be presenting today from Project Action, Thelma Green and Jermaine Payne. Jermaine is having some login issues, so as soon as Jermaine is able to join us, then I'll introduce the 2 of them, and they can do their presentation to talk about a number of issues that Project Action wants to address, including their upcoming meeting on Saturday, the 21st, which I will say was one of the better attended Project Action meetings I've ever been to. It was really impressive to me that Project Action was able to have this virtual meeting, and it may be just because, they had the Wi-Fi, so it's in their name, but a shout out to St. John's, because I saw several people that lived in places that said St. John's who had been able to participate. So thank you to that provider, and thank you to any other providers who are making this Project Action meeting available to the folks that you're supporting.
Excuse me, Andy, I was able to unmute Jermaine, so I just wanted to check in to see if she is on the line right now. Jermaine?
I am on the line.
Okay.
Wonderful. So Jermaine Payne and Thelma Green are here with us from Project Action, and they have some issues that they would like to discuss. So
Okay.
take it away.
Okay. This is Jermaine. Good evening. Good afternoon. My name is Jermaine Payne. I am a member of Project Action. I am the sergeant for Project Action. I also serve on different organization board in DC for persons with disabilities, like my own place and Frontline, where I receive my services. I think computers, iPads, and cell phones should be made available for persons with disabilities to be trained to use them as they can communicate with families, jobs, friends, doctors, and the outside community. At one of DDS meetings, Director Andy Reed, your information gave information about Comcast Internet for $9.95 for persons in the program with a disability. I called Comcast to send me an application because I don't have Wi-Fi at home. I use my cell phone. Now I have a tablet and a laptop. I need Wi-Fi services. I received a application and mailed it for approval to receive Wi-Fi at home. I have invited my mother to explain the process we are going through with Comcast to you. Thank you.
Good afternoon, everyone. My name is Claudia Payne, mother of Jermaine and member of Project Action. Jermaine asked me to explain our process that we are going through to receive Wi-Fi at home. Her application is a one-pager. It was mailed in to Comcast. You need to have ID and approval you are receiving disability services, and it has to be attached to the application. Because we don't have Wi-Fi access, I personally went to Comcast and presented the application that I was going to mail in, along with showing them Jermaine's ID and her picture that she does get services from DDS. Explain, as I said in person, why she didn't get it. I looked up the information in the computer for Comcast and they gave me a router when I went there with the application and her ID. I also have to assemble the router, so I will be calling them today to get information as to how to assemble the router. They said they weren't sending out people in the homes right now to do that. So they gave me the router, and yesterday I received a letter saying that Jermaine will have to do another application because they didn't get the ID information. But I don't think it's going to be a problem because I did go into Comcast. I explained myself when I was there, and they gave me the router. So I just have to know how to put this router in so we can have some communication. And maybe the next time we're talking, you'll see us on screen. Thank you.
Thank you. Thelma?
For project action. I'm here today to speak. I do have Wi-Fi and I do have iPad. But I'm here today to speak to make sure that all the providers make sure that those people who don't have iPads or tablets, to make sure that they have it and make sure that they have not only just have the equipment, but also make sure that it's Wi-Fi or something in there so that they can participate in the project action meetings or any other meetings like this one if they want to. And Anita, they getting it if the staff gonna be using it instead of working with them on using it. Now I can see if they're assisting them to use it and showing them, but if the staff using it more than the individual, that's not gonna help the individual now.
So I have posted the information about the upcoming project action meeting in the chat box. The meeting will be at 10 o'clock on November 21st.
Yeah.
They'll open the Zoom at 9:30 so that people have a chance to socialize before the meeting. There's both a Zoom link here as well as the phone number so that you can dial in and the meeting ID and password. At this meeting, there's going to be a presentation and a discussion on I guess more of just a presentation on assuring rights during COVID from Quality Trust and DDS. So we hope that people will help any folks that you support or any folks who are on who are interested will join us in that meeting next Saturday.
And I'm supporting Andy. I'm backing them up. I hope everybody listening and getting their individuals on to the meeting.
So if there are any questions for either Jermaine or Thelma, if you could type them in the chat box and we'll ask them to respond. There's a question here from before that about whether DC Health will be presenting on the ICF visitation guidance. I walked through that whole guidance 2 weeks ago and then offered that if there were any questions that people had, DC Health can respond to those questions. So I don't know that DC Health is prepared to walk through it, but they are certainly prepared to answer any questions that people have. So if you have specific questions about the guidance, you can type them in. And as usual, we do have Daryl Hawkins is here from DC Health, as well as some other representatives from DC Health who I expect could respond to those questions.
Yeah, that's correct, Director Reese. So if anyone has any questions about the guidance, any DC Health guidance, including the indoor visitation, we're happy to answer them and clarify. Thank you.
So there's a question here that says, I assume that the Comcast is something residential providers could request on behalf of people they support. My hope would be actually that the people they support could request it, Because if all you need is the ID and the proof that you're supported by DDS, we should be able, the providers should be able to facilitate people doing that so that they actually get the Wi-Fi in their own name. And I don't know any other information about this. I want to thank Germaine and her mother for bringing it to our attention, and we will look into it further and make sure that providers have information about this opportunity with Comcast. I agree. So someone's making the point, I want to make sure that providers have the information to help provide the support. And I absolutely agree. And like I say, this was news to me. It's nice to get news that's good news. And so we will follow up with Ms. Payne and Comcast and make sure that we have the information, and then we'll share it with all the providers once we have a complete answer.
I found some other links to RCN and Verizon as well. So I'll put that in a chat box for some services that are very low for low income folks.
I also wanted to share a little bit with people. The National Association of the State Directors of Developmental Disability Services has their conference. It started yesterday with a directors meeting, and it runs sort of afternoons through next week. With time zone issues, you can't spend 9 to 5 at the meeting because that would not be fair to the folks from Hawaii. And so we meet in the afternoons. But it was very interesting. Yesterday, the Centers for Medicare and Medicaid Services joined us, and they did share a little bit of information, just indicating that they are very aware that some of us, well, that for those states that started their Appendix K in March of 2020, that those would be expiring in March of 21, and they recognize that there is every expectation that they will need to go beyond that date, and that something will be forthcoming in the near future to give us some guidance about how that could occur. They also indicated that they recognize that the limitation on retainer payments for the day providers presents a challenge to states, but that at this time there was no ability to make any change to that, so that it is up to 90 days of service in the year. There wasn't a whole lot of other real news from them. So we're hoping we will get some news soon about where things stand in terms of extending or renewing an Appendix K, given that ours does expire on March 10th, 2021, which will be here before we know it. So there is a question here for DC Health regarding the visitation guidance. If a person living in an ICF cannot wear a mask because they cannot independently remove it, are they permitted to have indoor visitors?
Hi, this is Daryl Hawkins, and the answer is yes, they can, but keep in mind there are a lot of other infection prevention precautions that allow to minimize that risk of exposure. So, for example, that indoor visitor who is visiting that person in the ICF should be wearing a mask at all times, and again, socially distancing and all of the other guidelines set forth in that document. But the answer is yes. If they are not able to independently remove it, um, they are not required to wear a mask for their safety. Yes. But all the other individuals present who are visiting that person should comply with masking, or else they should not be permitted to visit. Thank you. Director Reese, I see another question in the chat about indoor visitation above that,
Oh,
and I'm happy to answer if needed.
oh, wow. Yes, I see. I'm sorry I had missed that. So the ICF indoor visitation guidance states restrictions on visitations do not apply to compassionate care and essential visitors or personnel defined by Mayor's Order 2020-063. I want to be sure I understand how that sentence impacts the scope of the guidance. Am I correct that DC Health is intending the guidance to allow indoor visitation in situations other than primarily compassionate care?
And the answer is yes. So that sentence above in the very beginning of the guidance is really speaking to the restrictions that follow in the guidance. So if the person, for example, is visiting for compassionate care situations, some of the restrictions below do not necessarily apply in those situations as specified by the mayor's order, but our indoor visitation requirements does allow now indoor visitation in ICF settings as long as they follow the guidance, even if it is not for compassionate care situations or essential visitors as defined by the mayor's order 2020-063.
Thank you. And I had missed another one up above there. I'm sorry. So, what is DDS's position on companion services being delivered at another provider's residential site? Some folks have opted to not return to day programs. With the rise in cases, I just wanted to know your thoughts about going from one provider to another. So, as I talked at the beginning about screening, if you went to their site as someone who's going to provide services at their site, you would need to be screened as any other staff or visitors to that site would need to be screened. There have, in fact, throughout the public health emergency, been some residential and day providers who have worked out agreements where the day provider was providing the companion services at the residential site. So that has been occurring as agreed between providers since the beginning of the public health emergency. The issue if you're providing the services there is exactly the same as the issue would be if you were providing them remotely, which is you can only be billing for one Medicaid service at a time. And so, you would be substituting for whatever residential staff would have been there at that time. So that's where it requires the agreement between the residential provider and the day provider. But those kinds of agreements are the kinds of things that we hope to see. We copied too much stuff in our chat box today. I'm just scrolling up to make sure that I've not missed any questions from people. Oh, the visuals last week were great. Can you update them next week, please? I assume you mean when I presented the data. If that's the case, if you confirm that, then yes, I can do that. Yeah. Yeah, and I agree. I think it is helpful to see the visuals. I know in particular when I look at it and see where we were in April and think back to how all of our providers, the folks we support, all of us got through that. Amazing. And it is why I just feel so strongly about how important it is that we really stay absolutely vigilant so that we don't see another spike like that.
Director Reese, as we wait for more questions to come in, can I piggyback off of like the messaging that you had provided earlier? Um, so as Director Reese very well put, you know, symptom screening for your staff is so important. And I do want to acknowledge that this is mentioned in the past a marathon. And it's a marathon also for your direct care staff to remind them that to continue to still have a low threshold for understanding what symptoms are. So I know it's really easy in the moment that you have a headache or a tickly throat, etc., to feel like maybe it's your allergies or to reason it away, to just remind them that we still have to remain vigilant and to consider any COVID-like symptoms as COVID-like symptoms, and to, out of an abundance of caution, stay home and not go to work. And this is even going to be more important as we enter into the holiday season, you know, just acknowledging the fact that not only do they provide like crucial services, but we're also asking these frontline workers to be extra vigilant in the exposures that they have. We do have an extra burden of being extra careful than the rest of the general population because of the nature of our work and the people that we serve. And to just acknowledge that that is difficult and it's a big thing to ask, but it's so crucial as we move forward into the holiday season and in this marathon of this pandemic. Thank you.
Thank you. Because, and you know, as I mentioned, we don't want to be back where we were in April. I should also mention how good things looked in June, July, August, September, October. You know, folks have really been taking the steps we need to take. And that's why I appreciate that you get tired. And as I said early on, this is a marathon. And earlier on, I was saying, and this is the very beginning, we're still a long way from the end of this. And it's essential that we remain vigilant at all times so that we keep these numbers down where they've been. Oh, and please do keep in mind, so when you want to ask a question, there's when you do the drop down, one says to all attendees, and we can't see those questions if you type them in. And then further down on the list, there's something that says everyone. You have to type to everyone, otherwise you will believe that we're ignoring your question, and that we are certainly not trying to do that. So if a person supported in an ICF is receiving nebulizer treatment or CPAP, what is the required PPE for staff in the absence of COVID-19? And I'm assuming that's for DC Health.
Hi, so per our updated DC Health guidance, PPE requirements for all healthcare facility settings. So this is going to be a requirement for any ICF, CRF, supported living, any facility that's licensed by DC Health is this or is provided a certification of need. This is a requirement. The requirement for AGPs, even for those without COVID, is going to be a respirator if that person is fit tested again, and as part of a complete respiratory program. So respirator, eye protection, which I think I covered last week what appropriate eye protection is. That would be a face shield or indirectly vented goggles, gown, and gloves that should be removed in between each patient, and hand hygiene performed before putting on any PPE and after removing any PPE. So that's for any AGPs, regardless of COVID status: gown, gloves, eye protection, respirator that is fit tested for that staff as part of a complete respiratory protection program. And then just as a reminder, AGPs should be done in a well-ventilated room. No other persons, except for those that need to be in that room, should be in that room. So that includes other staff and other persons being supported. And it should not be done in congregate areas. And again, that guidance is from the DC Health PPE requirements for healthcare facilities. For those that want to take a look at that, it's in our coronavirus.dc.gov under health guidance. Thank you.
Well, I've not seen any additional questions. There are lots of things in the chat, so people may want to read back through the chat because there's a lot of good information in there today. But if people don't have any other questions, we can end a few minutes early today and chat again next week. Okay. Thank you. And everyone have a good and safe weekend, and we will talk again next week. Thank you very much.